Across the United States, people of different populations tend to have differing access to good health and health facilities. These differences, caused by the distribution of disease, violence, and injury, are called health disparities. Health disparities have numerous consequences for our society, and they are also caused by numerous things, such as these.
One of the main causes of health disparities can be linked to lower socioeconomic status. It was found that lower socioeconomic status leads to a more toxic stress response due to the fact that those living in these environments have to go through life without the proper resources. It was found that those living in lower socioeconomic status environments lacked the proper education, did not have any form of health insurance, and were more exposed to dangerous toxins and violence.
Although socioeconomic status plays a huge role in health disparities, it's not the only reason they exist. There are several causes for health disparities. One of them is race. Race can create health disparities in several ways. One of them is that minority groups are more likely to receive lower quality care than majority groups. A lot of this has to do with the fact that minority groups tend to come from foreign nations, and this creates a language and cultural barrier between the doctor and the patient. Race can also create health disparities because certain races are more prone to specific diseases than other races.
For example, here is a random student enjoying the day. The one thing she doesn't know is that for Filipino immigrants, the longer they stay in the U.S., the more likely they will become overweight.
What?
Okay, thanks, bye!
The type and location of your home also influences disparities, because some homes are built in areas of increased environmental hazards, with the example of Libby, Montana, being the town was built near a mine that had high concentrations of asbestos. The asbestos eventually leaked out and spread to the rest of the town. Education differences also cause health disparities because the more highly educated a person is, the more health literate they are. That means a highly educated person is more likely to get great healthcare services than a lowly educated person. The following is an example of the importance of education in health.
So I got your test results back. Looks like you're HIV positive.
Positive. Positive is good, right?
No.
Health disparities exist among all our social institutions, such as family, school, government, and businesses. Society functions like an organism with different parts. If one part fails, then the whole organism shuts down. If individuals suffer from a health issue for a long period of time, they are at risk to develop a more life-threatening disease that could lead to death. This issue needs to be addressed because it is a moral wrong to ignore individuals who do not have access to proper health care. By eliminating health disparities, we can offer and ensure society with a better access to health care. This gives children and adults of all ages and ethnicities an opportunity to live a long and healthier life. When we have healthy people, we have a healthy society that can succeed.
The good news is there are several steps you could take to help reduce health disparities. There are steps you could take at an individual level and at a larger community and government level. As individuals, one of the things we could do is to take part in more preventive efforts. This could be anything from taking care of yourself by making sure you have proper diet and exercise, or taking part in larger community-led health prevention events. The Relay for Life and the Walk to End Breast Cancer are examples of these community-led events. Another thing an individual could do is to make yourself more health literate. The point of health literacy is to increase a person's ability to understand health information. At the same time, health literacy also means that an individual knows where to go for health care when they need it. There are also several things communities and organizations can do to help reduce health disparities. One of the things they could do is to assess the health needs of a population and the barriers that need to be overcome for the people of that population to reach those needs. By doing this, organizations and communities can begin to create a plan to implement those needs and deliver them to the community. Another thing these groups could do is to host more health education and opportunities around the community. It could be anything from a wellness fair that encourages activity like this one we had on campus, or it could be health education in the classroom, like this.
At your age, you're going to be having a lot of urges. You're going to want to take off each other's clothes and touch each other. But if you touch each other, you will get chlamydia and die. Okay, chlamydia. K-L-A.
Schools and similar institutions can also help improve health disparities by promoting outreach to other healthcare facilities. Another thing schools could do is to offer health services to students and their employees. For example, at CSULB, we have student health services for any healthcare needs, and we also have CAPS for psychological counseling. Governments can also play a big role in reducing health disparities. Similar to what communities have to do, governments can identify the specific health needs of a population and do something to improve it. What governments can do is they could pass laws to improve the population health as a whole. Health disparities is one of the persisting social issues that we have to face every day. They're caused by some of the most basic things like our gender and our age. But despite the numerous things that cause health disparities, the thing we should not forget is that there are just as many things we could do to help combat it.